In the world today, technology is everywhere. This also stands true in the world of healthcare. Nurses today require a wide variety of technological skills and must engage in continuous learning regarding technological advances in the world of healthcare. Nurses use many different types of technologies depending on which nursing specialty is selected. Specific examples include oncology nurses using technology to administer radiation and chemotherapy, labor and delivery nurses using fetal monitors, as well as emergency nurses who use ventilators, defibrillators, and many monitors and other technologies depending on specific injuries.
One of the many technological advances the medical world has seen is the creation of portable bedside monitors. Hospitals are quick-paced and induce high-stress situations, and one solution to help run things a little smoother came through the invention of these machines. These monitors measure a patient's heart rate, respiratory rate, temperature, and blood pressure. In the past, transferring patients to different rooms became a problem because the patient's vitals were difficult to obtain. Now, portable bedside monitors make it possible for a nurse to monitor their patients during this transition time. These machines also provide the nurses constant data and keep the patients from being interrupted so frequently while they are resting. And they as well improve organization and workflow.
The coming forth of electronic health records in 1972 has revolutionized nursing as we know it. Going into a new patient's room could have outcomes of nervousness, fear, and the feeling of being unprepared. These feelings don't have to be present. With the invention of electronic health records, nurses can feel confident due to the records that they have given in preparation to help the patients progress. They can know immediately if there's any needed medication for each patient, if they have any allergies to be aware of, what procedures and tests, if any, have been done, and what previous nurses have seen, tested, or observed with the patient before the new nurse comes into the room. Other benefits of electronic health records include legibility in records, organization, quicker test results, record safety, the limit of repeated tests, and patient access.
Another of the major medical devices that has greatly affected the nursing community is the automated IV pump or an infusion pump. The first successful infusion device was invented by Christopher Wren during his lifetime between 1632 and 1723. It was made from a pig's bladder and a writing quill. Since then, infusion devices have become sophisticated into what we know today as automated IV pumps. These devices are used to deliver fluids such as nutrients and medications to a patient at a programmable rate intravenously. Since these automated pumps have only surfaced in the last 40 years, it has helped tremendously in reducing medication errors, improving workflow, and providing a new source of data for continuous quality improvement.
With new technology in nursing today, the physical contact between patient and nurse has dramatically decreased. This has led to the question of how nurses maintain a caring bond with their patients when they are mostly dealing with machines instead of touching and helping the actual patient. One of the best ways to achieve this is to build a relationship with your patient through conversations. These conversations can be simple, such as asking how the patient is doing and offering to get them anything they need, or they can be more meaningful, like asking about the patient's life. Calling the patient by their name and talking to them as if they were your friend, not your job assignment, often helps the patient to feel more at home in the hospital. Another aspect to helping your patients feel cared for is using the right tone and having the right attitude. Patients can tell when a nurse is going through the motions of their job versus really caring for them. Although nurses have a lot less physical contact because of technology, there are many ways they can make the patient feel cared for through other interactions.